Anxiety cannot be treated in fragments. Talking alone is rarely enough. Medication alone is rarely enough. Real change requires continuity, biology, psychology, and environment working together without interruption. For over 20 years, we have worked with individuals whose lives carry enormous responsibility. What we have learned is simple. Anxiety is not weakness. It's vigilance that no longer serves you. At first, it looks like performance, sharp thinking, fast reactions, control. Over time, it becomes exhausting. The system has forgotten how to stand down, sleep shortens, decisions feel heavier. Even success brings tension, not relief. You're still functioning, but the margin is gone. We begin by stabilizing the system. As the body regulates, the mind gains space. Perspective returns naturally. This is why we work in private residences in Switzerland. When the environment is predictable and safe, vigilance drops. The real work can begin.
We begin with a thorough medical baseline, looking at things like cortisol patterns across the day, because a rhythm that should rise and fall is instead staying elevated, and that alone will make genuine rest impossible. We look at inflammatory load, because inflammation acts directly on the brain's threat detection system, making it fire more readily and recover more slowly. We look at metabolic factors, thyroid function, and the state of the autonomic nervous system, because any one of these, when dysregulated, can produce symptoms indistinguishable from the physiological kind. Once we understand the baseline, we stabilize it. The goal is not to remove the pressure, it is to restore the stability underneath it. We assess, we stabilize, and we build a plan for the life you actually need.
People often come to us saying, "I'm not ill, I'm just under pressure." And I understand that, especially if you've spent a lifetime functioning at a high level. Clinically, anxiety is not simply pressure. Anxiety is a threat system that has become overactive. It is your mind and body behaving as if something is about to go wrong, even when objectively you're safe. In high-functioning individuals, this can be hard to recognize. The key difference is not whether you can perform, it is whether you can recover. Insight alone doesn't solve anxiety. Sometimes medication can play a role. The measure of success is not that you never feel stress again. When anxiety is treated with the right intensity, medically and psychologically, with continuity, the system can learn safety again.
So much of the healing work isn't about fixing symptoms. It's about uncovering what's been carried underneath them for years and working to heal the root of the issue. As the deeper emotional layers are processed and supported, anxiety begins to lose its grip. It no longer has to work so hard to keep away what felt unbearable, because your system learns it can handle everything you experience, and you learn to transform beyond your pain. Recovery doesn't mean you never feel stress again. It means the static clears and the urgency reduces. You can feel what you feel without being hijacked by it, and you can begin to move through life with more calm, clarity, and choice.
Calm is not the absence of pressure. It is the ability to meet pressure without losing yourself, and that ability can be trained. We teach practical regulation, how to shift the body out of stress in real time. Breath, attention, and simple techniques that change your state, not in theory, but in the moment you need it. This only works if it fits your real life. So we build small practices into the day, between calls, before difficult conversations, and especially in the evening when anxiety often arises. You don't force peace. Your system starts allowing it. Anxiety can make you feel powerless inside yourself. But when you learn how to guide your state, you get something back that is priceless, and that's choice. And from that place, healing becomes possible.
The work doesn't end when you leave, it evolves. Your same team stays connected, reviewing your sleep, focus and mood, refining what's needed as life resumes. This continuity is part of the medicine, a living bridge between treatment and real life. Evenings are where most patterns live and where they begin to change. Each client works with a live-in therapist matched carefully to temperament and goals. You are supported by more than 15 specialists, physicians, therapists, and experts, all sharing one record, one plan, and daily communication. Switzerland is not just a location, it's an active ingredient in your recovery. This country holds a centuries-old memory of health and sanctuary. We're not just a clinic, we are part of a long tradition of restoration. There is a reason the world comes here to heal. When you arrive in Zurich, you step into a culture that values privacy and precision above all else. In a standard medical setting, the environment often works against you. It's sterile, noisy, and unfamiliar. That creates a specific kind of stress. For a high-functioning individual, a drop in your standard of living creates distraction. If you're worrying about your comfort or fighting the logistics of your stay, you're not focused on your health. That is unnecessary noise. We view comfort as a clinical necessity. We deliver our care in a private residence and partner with the Dolder Grand Spa, the best Switzerland has to offer. We know that psychological resistance is a vital diagnostic tool. It tells us where the work needs to be done. But we want to ensure that the only resistance you feel is the one that matters, the internal one. We remove every ounce of external friction, from the texture of the room to the seamlessness of the service, so that nothing stands between you and the clinical work.
We are the connective brain between your results and your plate. With our dietitians and chefs, we design a culinary healing experience you actually enjoy. Timing meals, balancing glucose, reducing inflammation, so you feel good while you eat and still feel good after.
The experience is end-to-end. We organize private aviation and meet you on the tarmac. A Bentley transfer brings you directly to the door. You do not touch a bag. You do not navigate a terminal. Our team acts as the defenders of your time. We handle the logistics, the security, and the details invisibly. You do not have to trade your lifestyle to get your health back. Speak privately with a lead physician today.